Unit 4, neuromuscular disorder. We will learn about epilepsy. Neuromuscular disorder, epilepsy. Epilepsy is a chronic neurological disorder characterized by recurrent, unprovoked seizure due to abnormal electrical activity in the brain. Not every seizure means epilepsy. Epilepsy is diagnosed when seizure occur repeatedly without a known trigger. This is the EMG of epilepsy. Cause or etiology of epilepsy. Epilepsy can result from multiple factors: genetic factor, mutation affecting ion channel, brain injury, development disorder, cortical malformation, metabolic disturbance, hypoglycemia, electrolyte balance, unknown causes, idiopathic epilepsy. Pathophysiology: seizure occur due to sudden, excessive, and synchronized firing of neuron. There are some excitatory neuron and then some inhibitory neurons. Due to the disturbance in this neuron, epilepsy occur. Leads to hyperexcitability and abnormal electrical discharge in the cortex. Types of epileptic seizure: focal seizure and generalized seizure. Focal begins in one area of the brain, involve both the hemisphere. In generalized, symptoms are convulsion, jerking, involuntary movement, loss of consciousness, awareness, or a sensory visual and warming seizure. Postural state: confusion, drowsiness, and seizure after seizure. Diagnosis: for diagnosis, we do EEG, which detect abnormal brain wave, MRI, CT scan, structural abnormalities, blood tests, clinical history like frequency, trigger of seizure. Treatment is anti-epileptic drugs. Non-pharmacological is ketogenic diet, vagus nerve stimulation, and surgical intervention. Complication is status epilepticus, injury during seizure, conjunctive impairment, psychological effects. Prevention and management is adhere to medication, avoid seizures, take proper sleep, safety measure, regular follow-ups with neurologist.